Okay, here we have David, and just about a month ago, he came in. He had some degenerative disc disease for his lumbar spine. Did they tell you had stenosis too?
No,
Just
just
the disc was thinning out. Yeah.
yeah, and they were tightening up on the vertebrae on the spinal cord.
Were you ever told you needed some type of spinal surgery?
Well, they did do carving out around the spinal cord to
Uh-huh.
give it more room.
But that really didn't help you.
Well, no, I think the damage had already been done.
Yeah, it may have made it worse, right? Yeah.
Yeah.
And then, so we decided to do the combination of the laser stem cell signaling plus the high concentrate true dose platelet rich plasma, where we counted your platelets, took your blood, spun it, and then we put it back in your the paraspinal muscles. So 1 month later, how's your back doing?
It's about the same in the back area.
Uh-huh.
I've noticed I've got more movement in my toes than I had before.
Yeah.
On the left, I can raise all five. On the right, I'm able to raise the big toe and the next two, lifting them back. Sorry. And and I could only slightly move the big toe on both of them before. So
yeah, because you had what's called drop foot.
That's correct.
Because maybe from the surgery, they might have damaged the nerves that control what's called dorsiflexion, the ability of your toes to dorsiflex or raise them. And
correct.
You feel you can raise your feet now when you're walking, doesn't feel like you're flopping?
Yeah, I still flop, but it's not as bad as it was before. I'm still not able to push with my feet yet, but I've noticed it's not really a swelling. I answered a small swelling in the feet, but to me it looks like they're growing again because they had shrunk up so much.
Yeah, I think we're getting more blood flow, working the muscles more. The nerves are starting to come online. All right. So I'm going to explain what's going on there. So Noah, we have a really remarkable case. David was not able to dorsiflex his toes because of nerve damage from the deep peroneal nerve, L4-5, and some of the S1 from his lumbar spine, from the damage from the nerves, either from the surgery or the nerve root compression. So what I'm going to have you do is let's have him sit on the gray chair.
Okay.
And could you tilt my screen down so I could see his feet? I'll let you know when I can. More. Okay, perfect. And Dave, why don't you take your shoes and socks off?
Okay.
Okay, Dave, I want you to put your feet right next to each other. And so before we did the treatment last month, could you kind of mimic how far you're able to raise your toes in the air, if at all? Barely. Okay.
Yeah, barely.
So the left was more than the right.
Yeah, and now
after the procedure, can you lift both of them?
Yeah,
there you go. So how many % more mobility do you think you have 1 month later?
Well, at least 20%, if not a little bit more, but
yeah,
because I don't think I can would ever get them back further.
Yeah.
I actually feel myself being able to push them back down, but once they get to the floor, there's not enough strength to push against the floor.
Okay.
With my ankles, when I lift my foot up,
yeah,
I can lift up, but I really can't push. It's just gravity pushing it down, but
exactly,
I can tell it's not gravity bringing my
how long was your feet stuck like that where you couldn't raise them at all?
I'd say for the last 3, maybe 4 years.
Okay. Wow. And so after the procedure last month, how long did it take you to feel where you had more mobility there?
I'd say about after week 2, I started noticing it.
Yeah.
And I bring in my girlfriend to look at it because I was so impressed myself, because sure, before I couldn't move them, and they're moving much more than they were even 2 weeks ago. So I've been watching it real close because that's my most concern for my balance for walking. I don't need the cane to walk, but when I stop, I can't push with my feet, so I don't have any balance. I dip at the knees.
Yeah. So I'm going to show you what's going on. Noah, could you tilt my screen to look at the nerve chart on the wall? Okay. And yeah, perfect. So Noah, go ahead and take the laser and point at the deep peroneal nerve in the calf. See the deep peroneal nerve? And trace that all the way up. It goes to L4-5. So that's where we put the cells in the PRP and lasered it, right? And then what that does, it's going to decrease pain, inflammation, help regenerate that nerve. And that activates your tibialis anterior muscles. And now you're able to activate those nerves and dorsiflex your feet. So the way your body works, it's called centralization. Usually you heal from the outer extremities in. That's why you still have back pain. First, you're going to heal the nerves in your feet, and then it's going to regenerate those nerves all the way to the center of the spine. So you're right on track, because those nerves that branch out from the L4-5 that go to your toes, they're like 2-3 feet long. So give it a year to regenerate. I was estimating 10% improvement a month, 20% better. Okay. And Noah, could you kind of tilt the screen towards the door more? Perfect. And let's see how you're walking more. I want you to see to walk out the door and come back. Can you kind of mimic what you were walking like before?
It's kind of hard to mimic it before.
Yeah.
But
And how are you walking now?
I'm walking a little better.
You're not limping as much. I noticed that. Yeah.
It's a little bit of a waddle now.
Yeah.
But
It'll take a while because your brain is used to not using your feet. But now that you can, give it some time. All right.
Yeah. No, I'm feeling very impressed with the improvements and everything.
Yeah. Well, what we're gonna do, Dave, is we're gonna do some electrical therapy, shockwave therapy, laser to help stimulate the nerves. And we have you come back 1 time a week for a month to do that. And we'll do a follow-up in a month just to track your progress. Okay.
Okay, great.
All right. I'm glad it's working. We'll see you in about a month. Okay, buddy?
All right. Appreciate it. Thank you.
So Noah, let's just do neogenesis down both legs and 1,000 shocks in his lumbar spine. All right.
Okay.
So 1 time a week for a month and a follow-up. All right. I'm glad it's working. This is what it's all about. We'll see you in a month.
Thank you, sir.
Bye-bye.